Preparing for an initial home health survey can feel overwhelming, but it doesn't have to be. If you're setting up a new agency or going through your first state or accreditation survey, the key is to be prepared, stay organized, and know what surveyors are looking for. Preparing for a Medicare state survey is an ongoing process, not a last-minute task. By ensuring compliance before the survey happens, your agency will be better positioned for success. In this video, I will share some very important tips when preparing for an initial home health survey. Let's dive in. Pro tip number 1, survey readiness over survey preparation. Start at least 12 months in advance. Regular survey readiness audits will keep your agency compliant year-round. Don't wait until the survey is expected or announced. Pro tip number 2, before an initial survey, ensure that you have done the following. Completed the state licensing process, completed and submitted a Medicare enrollment application, provided nursing and one other skilled service, obtained the required minimum active census, understand and are in compliance with Medicare conditions of participation and state requirements. Notified the state agency of readiness for initial survey. Pro tip number 3, ensure that your policies and procedure manuals are up to date with state and federal regulations and align with the Medicare conditions of participation and your accrediting body's standards. Pro tip number 4, do a pre-survey internal audit. Randomly pull 5 to 10 charts and review them like a surveyor would. If you find any issues during your mock survey, fix them as soon as possible. Don't wait for the real survey to expose them. Pro tip number 5, if possible, bring in an external consultant to conduct a mock survey. They'll catch things you might overlook. Pro tip number 6, hold a mock survey interview with your staff before the actual survey. If they struggle to answer questions, provide additional training. Pro tip number 7, conduct an HR audit ahead of time. Surveyors will review employee files to ensure all licensing, training, and background. They check to make sure everyone is qualified and up to date. Expired credentials or missing documents could result in a deficiency. Pro tip number 8, review all patient records and documentation. Surveyors will randomly select patient charts to review. They're looking for accurate, complete, and compliant documentation. Pro tip number 9, designate a survey response team with roles assigned. This way, everyone is productive and it allows for an organized flow of events and professionalism. Duties to assign may include calling of clinicians about late notes and missing credentials, calling of patients to notify them that staff may be accompanied by a surveyor, someone to make sure consents and rights are being reviewed with patients on admission. Surveyors may ask patients if this was done. Calling of doctors' offices to follow up on pending orders, communication notes, plan of cares, signatures, etc., retrieval and printing of documents requested by the surveyor, email and fax portals monitoring for incoming documentations and communications, filing of printed and faxed documents, organization of folders, documents in the order of request by the surveyor, someone to handle errands when needed, checking for any late notes older than 7 days, retrieval of any expired or missing credentials, review of charts for high acuity patients such as wound care, IV, Foley, JP drains, patients on oxygen ventilators, etc. Pro tip number 10, when requesting additional documents or information from field staff, contractors, and staff working remotely, start every sentence with "the surveyor is here" to set the tone among your staff. Don't do this unless the surveyor is truly on site. Pro tip number 11, make sure there's a designated alternate administrator when the main is unavailable. Pro tip number 12, have a dedicated space and a computer or tablet set up for surveyor use if possible, with login information available. Pro tip number 13, keep a survey readiness binder with all essential documents in one place for easy access. Pro tip number 14, surveyors may ask staff about certain policies. Make sure they know where to find them and understand them. Pro tip number 15, print an index of policies and review it with staff before the survey. Pro tip number 16, ensure compliance with patient care standards, patient assessments and care plans, medication management, patient rights and grievances, infection control and safety procedures. Pro tip number 17, prepare for emergency preparedness questions. Surveyors may quiz staff on emergency procedures. Surveyors will check if your agency has a solid plan for handling emergencies like natural disasters, fires, power outages, or pandemics. Make sure your staff know the agency's emergency plan and procedure and where to find it. Pro tip number 18, ensure compliance with infection control policies. Make sure staff know the agency's infection control policies and are able to demonstrate proper procedures during patient care visits. Pro tip number 19, have your infection control policy, training logs, and infection tracking binder ready to show during survey. Surveyors will likely ask your field staff about infection control. Prep them to be confident and consistent. Pro tip number 20, print out the following rosters and have them ready when the surveyor walks in. Your unduplicated active client roster for the past 12 months, your discharge roster for the past 12 months, your active employee roster. Pro tip number 21, keep training logs, sign-in sheets, and digital records accessible and survey ready. Pro tip number 22, research on the most commonly cited deficiencies for home health agencies and how to avoid them. Pro tip number 23, use a single point of contact for surveyors, usually administrator or director of nursing, to streamline answers and avoid miscommunication. Pro tip number 24, during survey, avoid guessing or over-explaining. If you're unsure, say, I can get that information for you. Pro tip number 25, train all staff on how to politely defer questions to the appropriate leader if they're unsure. They can respond by saying, that's a great question. Let me connect you with our director of nursing who can walk you through that process. Pro tip number 26, use your policies as your script. If unsure, say, let me pull up the policy so I can give you the accurate answer. Pro tip number 27, make sure staff have their badges and are in proper uniform or attires. Have working equipment such as BP cuffs, gloves, wound care supplies, etc. Pro tip number 28, make sure patients are aware staff may be accompanied by a surveyor. Pro tip number 29, surveyors may ask a nurse to demonstrate proper hand hygiene or bag technique before entering a patient's home. If they don't follow proper protocol, that could result in a deficiency. Surveyors will cite if they observe bag on the floor, no barrier used, no hand hygiene before or after patient contact, clean and dirty supplies mingled, cross-contamination, reused gloves or used equipment re-entering the bag. Pro tip number 30. Surveyors may quiz staff on how they would handle a power outage during a home visit. Make sure they know the answer. Pro tip number 31. Use the CCC method. Clarity. Is the documentation or process clear? Consistency. Is it done the same way by everyone? Corrective action. If an issue is found, can you show how you fixed it? Pro tip number 32. During the exit conference, do the following. Stay calm and professional even if findings feel unfair. Take detailed notes on every tag issue mentioned. Ask for clarification if something doesn't make sense. Request examples of cited issues. You may need them for your plan of correction. Confirm how and when the CMS 2567 will be delivered. Thank the surveyor for their time and feedback. Pro tip number 33. During the exit conference, do not do the following. Argue or become defensive. You can clarify in writing later. Try to explain, correct, or justify everything in the moment. Bring up unrelated complaints or grievances. Skip the exit. You need to know what's coming. Make verbal promises or corrections on the spot. Pro tip number 34. Conduct follow-up audits post-survey to prevent repeat deficiencies. And lastly, pro tip number 35. Hold a brief all-staff huddle within 24 hours of the exit conference to share findings as appropriate, review what was requested, what was reviewed, what questions were asked, any red flags or themes, reinforce a culture of compliance and transparency, remind staff not to panic. It's a process, not a punishment. Thanks for watching. For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. For a detailed 50-page PDF file on how to prepare for an initial survey, or if you're looking for other helpful downloadable digital resources on home health management, visit my Etsy shop, link provided below. For questions and insights, drop a comment, and if you know someone who could benefit from this video, feel free to share. See you in the next one.